Hello everyone. Today my topic of discussion is Bethesda system of reporting thyroid cytopathology. So here we will discuss this topic in detail as we follow. So here we have to concentrate that thyroid is a structure which will be aspirated by a method known as fine needle aspiration cytology, okay, called as FNAC. Alright, so here this Bethesda system of reporting thyroid cytopathology is useful to know or to differentiate benign, atypical and malignant thyroid lesions. Alright, benign, atypical and malignant thyroid lesions are differentiated or can be differentiated by FNAC. So let us discuss this Bethesda system of reporting thyroid cytopathology under following subheadings. First, we have to discuss its category, its risk of malignancy, and ultimately the management. Okay, first category, then risk of malignancy, then ultimately what is the management that we take or that is required for these thyroid lesions. Okay, then coming to category. Okay, there are total 6 categories. Total 6 categories are there under Bethesda system of reporting thyroid cytopathology. Okay, so coming to category 1. Category 1 it is depicted as non-diagnostic category. Okay, so here in non-diagnostic category, the risk of malignancy is cannot be mentioned because why the risk of malignancy cannot be mentioned or cannot be made out in category 1 of Bethesda system of thyroid cytopathology, because here the specimen is inadequate. Alright, the specimen is inadequate and the specimen is inadequate and the smear which we make has low cellularity. Alright, has low cellularity, and at sometimes because of poor fixation the thyroid follicular cells cannot be examined on the smear. Alright, so here the category 1 it is non-diagnostic, and in the category 1 the risk of malignancy cannot be mentioned or cannot be made out because the specimen received is inadequate and the smear shows low cellularity, and at sometimes because of poor fixation the cells, that is the thyroid follicular cells, cannot be examined on the smear. Alright, so coming to management. So what is the management that we can be make or can be made under category 1 of thyroid cytopathology Bethesda system? Okay, so here we have to repeat the FNAC method. Okay, that is fine needle aspiration cytopathology. Okay, fine needle aspiration cytopathology. All right, right. Then coming to category 2. So under category 2 we include benign lesions. Okay, so benign thyroid lesions which include colloid goiter, lymphocytic thyroiditis or Hashimoto's thyroiditis, or can be a hyperplastic nodule. Okay, can be a hyperplastic nodule. So these are the benign thyroid lesions which are included under the category 2 of Bethesda system of thyroid cytopathology. So coming to risk of malignancy. Risk of malignancy for category 2 of Bethesda system of thyroid cytopathology is less than 1%. Alright, is less than 1%. Okay, so coming to management. So how we manage thyroid cytopathology category 2 of Bethesda system? So how we manage? We manage by making a clinical follow-up, that is by checking the T3, T4 TSH levels. Okay, T3 T4 TSH levels. All right, then coming to category 3. Category 3 of Bethesda system of thyroid cytopathology. So the category 3 of Bethesda system of thyroid cytopathology include the following lesions, that is follicular lesions of undetermined significance. Okay, follicular lesions of undetermined significance. Follicular lesions of undetermined significance, or it is also known as atypia of undetermined significance. Atypia of undetermined significant. Why we call category 3 of Bethesda system of thyroid cytopathology as follicular lesion of undetermined significance or atypia of undetermined significance? Because here in category 3 of Bethesda system of thyroid cytopathology, the smear pattern is here. The smear pattern is not convincingly present. That is, either the smear has more cellularity or the smear has less cellularity. That is, here the smear has the cellularity which is not that significant to make a confirmed diagnosis. So the thyroid lesions that fall under the category 3 are named as atypia of undetermined significance or follicular lesions of undetermined significance. Okay, atypia of undetermined significance or follicular lesions of undetermined significance. So under category 3, we have benign thyroid lesions showing some atypia and we also have follicular neoplasms. Okay, we have benign thyroid lesions showing some atypia and we have follicular neoplasms. All right, so the risk of malignancy for category 3 of Bethesda system of reporting thyroid cytopathology is about 5 to 10%. Okay, is about 5 to 10%. Then coming to the management of Bethesda system of reporting thyroid cytopathology is repeat FNAC or follow-up clinically. Okay, repeat FNAC or follow up clinically. All right. So until now we discussed category 1, category 2, category 3 of Bethesda system of reporting thyroid cytopathology. Okay, so category 1 is non-diagnostic. Category 2 includes benign lesions such as colloid goiter, lymphocytic thyroiditis, hyperplastic nodule. Category 3 includes follicular lesions of undetermined significance or ATP of undetermined significance, which include the thyroid benign thyroid lesions which show some atypia or follicular lesions. Okay, so the risk of malignancy for category 1 of thyroid Bethesda system is not mentioned. That is, we cannot make or we cannot assess the risk of malignancy for category 1 of Bethesda system of reporting thyroid cytopathology because the specimen received here is inadequate and the smear which we interpret has low or poor cellularity, and sometimes the poor fixation is also a reason for having a poor cellularity on the smear. And what we have to do here in category 1 of Bethesda system of thyroid cytopathology, here we have to repeat FNAC and we have to follow up. Okay, so in category 2 of thyroid Bethesda system is the risk of malignancy is how much? It is less than 1%. Okay, and what we do manage? We manage category 2 thyroid lesions by making a clinical follow-up, and by coming to category 3 of thyroid lesions, the risk of malignancy is 5 to 10%. And how we manage? We manage category 3 of Bethesda system of thyroid cytopathology by doing a repeat FNAC along with clinical and radiological follow-up, or we have to correlate both. Okay, so coming to category 4 of Bethesda system of reporting thyroid cytopathology. Okay, so category 4 of Bethesda system of reporting thyroid cytopathology includes follicular neoplasm or suspicious of follicular neoplasm. Okay, follicular neoplasm or suspicious of follicular neoplasm. All right, so what are the lesions that are included under category 4 of Bethesda system of thyroid cytopathology? The lesions that are included under Bethesda system of reporting thyroid cytopathology of category 4 are follicular and Hürthle cell neoplasm. Follicular and Hürthle cell neoplasm. Okay, follicular and Hürthle cell neoplasm. The other diagnostic terms that are included under category 4 of thyroid Bethesda system are follicular lesions follicular lesions with micropapillary proliferations. Okay, follicular lesions or follicular lesions with micropapillary proliferations. So here under category 4 of Bethesda system of thyroid cytopathology, the risk of malignancy is how much? The risk of malignancy is 20 to 30%. So the risk of malignancy for Bethesda system of reporting thyroid cytopathology category 4 is 20 to 30%. So how we manage category 4 of reporting thyroid cytopathology? That is, here patient should definitely undergo lobectomy or hemithyroidectomy surgery. Okay, so here under category 4 of Bethesda system of reporting thyroid cytopathology, the patient should definitely undergo lobectomy or hemithyroidectomy surgery. Okay, all right. Next, coming to category 5 of reporting thyroid cytopathology of Bethesda system. It includes suspicious of malignancy. Okay, suspicious of malignancy. So under suspicious of malignancy, it includes suspicious of papillary variant, suspicious of medullary variant carcinoma of thyroid, or it includes suspicious of anaplastic carcinoma of thyroid. Okay, so under category 5, which includes suspicious of malignancy, this suspicious of malignancy includes suspicious of papillary variant of thyroid carcinoma, suspicious of medullary variant of thyroid carcinoma, suspicious of anaplastic variant of carcinoma of thyroid. Okay, so next we move to risk of malignancy. Risk of malignancy for category 5 of Bethesda system of reporting thyroid cytopathology is how much? Is 50 to 75%. Okay, 50 to 75%. Then how we manage Bethesda system of reporting thyroid cytopathology category 5? We do total thyroidectomy. Okay, total thyroidectomy. All right, coming to category 6, the last category of reporting thyroid cytopathology of Bethesda system includes definitive or confirmative malignancy. Definitive or confirmative malignancy, which includes specific type of malignancy. Okay, specific type of malignancy. What do you mean by specific type of malignancy? We mean it as frank papillary variant of carcinoma thyroid, frank medullary variant of carcinoma thyroid, frank anaplastic variant of carcinoma thyroid, okay. Here I want to emphasize a very important point regarding why we cannot make a diagnosis of follicular variant of carcinoma thyroid on FNAC, because here follicular adenoma, which is a benign thyroid lesion, and follicular variant of carcinoma thyroid, which is a malignant thyroid lesion. Okay, malignant thyroid lesion. So for making or distinguishing this follicular adenoma versus follicular carcinoma of thyroid, follicular adenoma versus follicular carcinoma of thyroid, which cannot be distinguished on FNAC. Why? Because for making a diagnosis of follicular variant of carcinoma of thyroid, follicular variant of carcinoma of thyroid, it should have vascular and capsular invasion, which are the two important criteria: vascular and capsular invasion. Vascular and capsular invasion should be present for making a diagnosis of follicular variant of carcinoma of thyroid. So here on FNAC, we neither take out the capsule, that is, we neither aspirate the capsule of thyroid, or we either take the blood from the vessel we only examine the thyroid follicular cells. On FNAC. So as there are no capsular or vascular invasion seen on FNAC, we cannot make a confirmed diagnosis between follicular adenoma and follicular variant of carcinoma thyroid. Follicular adenoma and follicular variant of carcinoma thyroid. Okay, so coming to risk of malignancy of category 6 of Bethesda system of reporting thyroid cytopathology, how much? It is of 97 to 99%. 97 to 99%. Okay, and how we manage the category 6 of Bethesda system of reporting thyroid cytopathology? We same as category 5, we advise total thyroidectomy. We advise total thyroidectomy. Okay, we advise total thyroidectomy. So here, as we know, as we discussed, category 1, category 2, 3, 4, 5 and 6 categories of Bethesda system of reporting thyroid cytopathology. Okay, so as we go from category 1 to 2, 2 to 3, 3 to 4, 3, 4 to 5, 5 to 6, the chance of malignancy what? The chance of malignancy gets increased. The chance of malignancy gets increased. So here the management criteria also gets shifted from medical therapy to surgical modality. Okay, and the risk of malignancy gets also increased. I already mentioned that malignancy risk increases as we proceed from category 1 to category 6. Okay, category 1 to category 6. So that's all from today's class. So I hope you have enjoyed my class regarding the Bethesda system of reporting thyroid cytopathology. If you have any queries, you can email me at this email gmail.com arunmunna1990 or you can comment me below the video. Okay, that's it. Thank you.